Captain Matt DeRousse is with us today. He is the EMS coordinator of the Bloomfield Township Fire Department. Captain Matt DeRousse. Let me get that right, Matt. Sorry to mispronounce your name. How you doing today? Welcome to the MegaCast.
I'm doing well. How are you?
I am fine. You see, it says D and R here. We're going to get this right. Captain Matt DeRousse. Is that close?
It's DeRousse.
DeRousse. I see it now. Okay. See, the guys did it right, and then I made my own. Forget it. How you doing? Happy Tuesday.
Thank you. Same to you.
So last week, I think it was last week, we didn't get a chance to say thank you to you and all the folks in Bloomfield Township, but it was EMS week, I believe, last week. So thank you to you and the other first responders in Bloomfield Township.
You are welcome, and it's a privilege to serve.
Well, it's awful kind of you. We see the numbers today, and they are moving in the right direction. Articles in our major papers today say 202 cases on Memorial Day, and I know we always have fewer because there's less testing over the holiday, but the way I read that and the other media outlets are saying that is the lowest number we have had since the end of March. That's got to be good news to you guys on the front line.
It is. It's real good news, and it's consistent to what we're seeing here in the township.
Well, I mean, that's great news, and we can go in and take a look at the Oakland County numbers and see exactly what's going on in our own area. But do you feel it, Captain? You actually feeling it in fewer calls or fewer calls related to COVID-19?
Definitely fewer calls related to COVID-19. The crews may go on one or two a day, and if it's a couple, anything more than one lately, then that's a busy COVID day for us. So there are days that we don't go on any of the runs.
Whenever the phone rings in one of our 911 centers or EMS centers, I always wonder, well, do you have to pick that up? Or are we okay?
We're good.
A call comes in, it's not going to hit your phone, probably.
Correct.
Okay. Well, again, I really appreciate you joining us today. Did you, as you were taking a look at this at the very beginning, it had to be overwhelming for your staff those first couple of weeks as numbers are really beginning to spike in late March and early April. Could you talk about the challenging times that we've been through?
It was a bit overwhelming. Fortunately, very early on, we saw this coming, and as other departments and agencies were doing, we were putting in a lot of time trying to come up with a new response plan, new policies, and we were really just doing what we thought was best practice, but we didn't have any history behind it to know if it was going to work. So we started getting the plans in place early, and then a couple of things changed the way we did things, and it got us in the right direction. And that was, we went to some early runs where the dispatchers had just started screening folks, and we didn't quite get accurate information. So the crews went in and essentially got exposed to a potential COVID patient without full PPE and precautions taken, just based on that screening information. From that point on, we just made the stance that everyone has COVID-19, we will treat them that way. We're going to respond that way. And we limited the number of crews that would interface with a patient. And that has proven to not only do well for us, but that's kind of the more common policy that most departments have adopted, at least in the area, but I would imagine throughout the country.
Captain Matt DeRousse is joining us. He is the EMS coordinator, Bloomfield Township Fire Department. Captain, thank you very much for joining us. Not only good policy for you and your crews, but it's just what the general public is now being told. Wear the mask. Think of everybody that you encounter as somebody that has COVID-19, and then you're doing everything you can to keep yourself safe and keep the people around you safe.
That's very true.
So, I mean, that's where we are right now. But, that, Captain, just, it typifies what this whole thing is all about. There's a learning experience. It takes time. We've not been through a pandemic like this since, the 1912, they say, and it takes time to figure out. I'm sure you've learned things in the process locally right there in Bloomfield Township as well.
Yes, for sure. It took us, and again, we were on the front end. We were early, we being the firefighters, and getting used to the response, getting used to the extra PPE, and then you could see as this starts to ramp up, where we were in full swing, and you just watching the public, as you mentioned earlier, and still at the grocery stores, all of the workers, no masks, no real PPE for them, and the public coming in and sparsely would have masks on to where we are now with everyone having masks. That's the only way that we're going to keep from having a resurgent, a second wave type of thing, is if we keep those masks, good hand washing, hygiene, social distancing, all of those things. We can open up our country again as long as people are responsible with that type of behavior.
Well, we certainly hope so. Captain Matt DeRousse joining us, EMS coordinator, Bloomfield Township Fire Department. We certainly hope so, and that's what this show is all about. Get local information and encourage people to do the right thing. I'll just tell you anecdotally, from traveling around the state of Michigan as I did over the weekend, and I've got a place up north, so don't send me cards and letters saying it was, what are you doing? Driving up north for the weekend. And I was working. I was out there reporting too. So, but my observations, and I think this is valuable for people here in Oakland County. Captain, in Petoskey and Traverse City and in northern Michigan, they have a far more cavalier attitude than we do down here about COVID-19. And I guess it's no big surprise they haven't had the cases that we have, but people don't wear masks. You see, maybe, a lot of people are, I don't want to chastise northern Michigan. A lot of people are doing the right thing, but I would say, by and large, anecdotally, they have a slightly more cavalier attitude up there. And down here, when I came back home, it was like, wow, yeah, I felt like I was in an area that was suffering this crisis because everybody seems to be doing the right thing. And that's, to me, the big story today, Captain, and you probably see it as well. I'm so impressed, especially as we now get into summer, and it's uncomfortable wearing a mask when it's 85 degrees outside. Everywhere I go, I see people doing the right thing. How about you?
Same. And you're right. I can't expect the people that are outside of the Metro Detroit area or in the more populated areas to feel the way that we feel. We've been hit with, some of the worst cases in the country. So we were conditioned early that it's bad and it's here and it's real. And the others up north have just been staying at home. And as you say, they just did not feel the reality of it. So they don't have the built-in precautions. They don't have those behaviors built in yet. And they may never have to. And let's hope that's the case, that the disease doesn't get up there like it did here.
Well, let's hope that. But I just wanted to reinforce that to folks after being around over the weekend and seeing what I saw, what a good job. What a good job we have done down here and how serious everyone is. And I had to pick up a couple of groceries on Monday, and same thing. And I'm sure when Erica Jones gets out in your community, where she is heading right now, Captain Matt DeRousse, I'm sure she's going to find the same thing, that there are people with masks. So big day today. Retail opens up. Car dealers open up. Any thoughts about that? Does that impact your operation at all, sir?
No, not really. We'll have more traffic out, but we're kind of seeing that gradually build anyway, which just brings its own, another set of emergencies for us. You increase the traffic when the weather gets nice and people out and a little more active, and we'll get more car accidents and those related incidents. But no, I think it's a very good thing. I anticipate having some of these stores opening the way they are. And as long as people continue to be safe and wear the masks, as you mentioned, what a good job everyone's doing. I think it's just everybody's ready for this point, and I think it's a good thing and it's timely.
Well, it is, and we all need a little summertime, and we're getting that. Let us be aware, and I'm sure you are, and we'll go out with this question, but let's keenly be aware that the virus is still out there. I mean, the virus hasn't gone anywhere. We've changed our behavior. It's out there, and if you needed any evidence, even in northern Michigan, we've been talking about it, a story about two people from outside of the state of Michigan, not from downstate, but from outside of the state of Michigan, coming to northern Michigan, and now they got contact tracing, and they've got to follow up on these two people that brought the coronavirus to Traverse City. The same could happen here. We have to be careful. Captain, do you have plans in place should we see another spike? Some people are predicting it in the fall as weather cools down.
The plan is the same plan that we have from the very beginning. We will continue to respond the way that we have in terms of our personal protection. So nothing really will change there. The only thing that we may have to make an adjustment on is we had a very a large kind of intensive decon procedure for our trucks, equipment, personnel after they transported somebody to the hospital. That has been broken down and kind of now each station has their own procedure. And that's just because of the infrequency of the COVID transports now. That would have to change again and ramp back up to a more of a full production in one location if we get back to the numbers that we had seen a month or so ago.
Captain DeRousse, I appreciate you mentioning that because, people are concerned if they have some other medical condition. Now more people are going to see their doctors and head out to the hospital with other things, and we're all worried about the coronavirus. And you want to make sure that you folks, first responders and hospitals, are doing what they can to make sure that things are cleaned up, that we're going to be safe. So, and again, I'm sure that if someone is the recipient of an EMS call in Bloomfield Township and any of our communities, they don't need to worry about COVID-19 from whoever might have been in that vehicle before they were there.
Now, one of the very first things the medic does when he approaches that patient is puts a mask on them, and that in itself cuts down the risk by a tremendous amount. So once you're able to stop the airborne transmission, or at least minimize it by putting a mask on, that reduces the risk for everyone. So then once they're transported into the back of that rescue, really just a simple wipe, hand wipe, disinfect of the vehicle would be probably enough, but we go way above that. So it's a very thorough process, and there's a very slim chance that there's any germ of it in that rescue for the next call.
Captain, again, thanks for your service. Thanks for joining us today, and we enjoy staying in touch with you and your colleagues around Oakland County. Keep up the great work, and we'll talk soon.
Thank you.